The national public health emergency may continue for all of 2021. In a recent letter to state governors, the acting Health and Human Services Secretary Cochran wrote, "To assure you of our commitment to the ongoing response, we have determined that the PHE, the public health emergency, will likely remain in place for the entirety of 2021. The administration also promised more predictability around this emergency declarations. And Cochran continues, when a decision is made to terminate the declaration or let it expire, the U.S. Department of Health and Human Services, HHS, will provide states with 60 days notice prior to that termination. This would mean that Medicaid programs enrollment, for example, continues through January 2022, and states would continue to get that enhanced federal Medicaid funds through March of 2022. They promised the predictability so states can start planning now how they're going to eventually be transitioning people from these Medicaid programs and have it be not as rocky as we might anticipate should that declaration end and that be a surprise. Now, recall, before the change in administration, it was then HHS Secretary Alex Azar who renewed the public health emergency for an additional 90 days, which took it to April 2021. That was the fourth time that that emergency had been renewed since January 2020. That continuation now, as Cochran tells us, is likely to be pushed through all of 2021. This declaration means that the changes continue that are both regulatory in nature and funding that is coming into states. And it is quite a lot. It was the Center on Budget and Policy Priorities that estimated that states can count on something close to $44.5 billion in additional relief for calendar year 2021. They write in their announcement, this should help states avert unnecessary, potentially damaging cuts as they craft their budgets for the coming year. That's part of that predictability that the department was talking about. States are getting ready to release their budgets for the next 2 years. They need to know how much money they can count on from the feds and what they're going to be asked to carry themselves. Having this predictability makes that decision a little bit easier. States can use federal dollars to respond to changing public health needs, prevent Medicaid cuts, and weather, ultimately, the economic downturn. In the description below, we give you the letter to state governors that came from HHS. We also give you that blog that gives you the quotes and the estimated amounts of federal money states can count on.